I know that staying home for a month is really difficult, but please do not make a daily outing to the grocery store or the convenience store. Please go when you need to go, because staying home means staying at home. Staying at home is the only way that we can slow the spread of COVID-19 through our communities and through our Commonwealth. Staying at home is the only way we can protect those on the front lines who are caring for our loved ones in hospitals and nursing homes. So please, stay calm, stay home, stay safe. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. Or use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands, and try not to touch your face, especially after touching surfaces. Clean surfaces frequently. Practicing these everyday prevention measures can help slow the spread of the virus COVID-19. If you have questions about your health, please contact your healthcare provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember, stay calm, stay home, stay safe. And now I believe the Governor and I will answer questions.
Thank you, Secretary. Governor, the first question is for you. From ABC 27, can you talk about the state's efforts to solicit donations of medical masks and supplies from private companies across the state? How has that been going, and have businesses been responding to the requests?
We're actually trying to buy as well as receive donations from businesses across the state and individuals as well, and we'll do more in this in the future. Right now there's a shortage of masks, but there are different masks that are being made for different settings. There are masks that you can wear when you go about your daily business. It keeps others from getting infected if you're at the food store. There are masks that can be helpful for the safety of workers in our county assistance offices. There are masks that can be used for people working in long-term care facilities, and then there are the surgical masks that people or healthcare workers need in hospitals. So we're working diligently every day, every hour to try to get more of these masks, and we will continue to do that, whether it's by donation or purchasing them.
Governor, a couple of questions about enforcement from Spotlight PA and the Lewistown Sentinel. What guidance are you giving state police or other local law enforcement agencies about enforcing the stay-at-home order? Should they stop people who are out and ask them why they aren't home, or question groups of people who may not be practicing social distancing? Are you recommending that law enforcement simply provide warnings, or do you think that there should be a more serious consequence?
At this point, we're focusing the state police efforts on business closures, and it strikes me that, as I said in my comments, that all of us have a vested interest in staying at home. We're keeping others safe by doing that, and we Pennsylvanians, I think, are going to be doing that voluntarily. That's what's happened in the counties that have had the stay-at-home order, as I said, and I don't expect that we'll see any difference when it comes to people, individuals, citizens, staying at home and doing this because they know it's the right thing to do.
Governor, from the Pocono Record, are there any plans to shut down the short-term rental market in PA, being that communities such as the Poconos have shown concern that residents from out of the area or state are coming there to escape to the areas where that have been heavily hit by COVID-19?
Yes, we actually did that yesterday. Shut down short-term rentals like Airbnb in the Northeast, and I want to thank the legislators on both sides of the aisle and both chambers were very helpful in bringing this to my attention, and I think we reacted very quickly to that. There is nothing that's essential about a short-term rental in the Poconos, and so we have shut them down.
Secretary, the next question is for you. From the Altoona Mirror, given that a CDC official said that up to 25% of positives are asymptomatic, should the department consider testing without symptoms?
So right now we have a number of different testing facilities available. One is through our state laboratory, and we're prioritizing patients with symptoms who are very vulnerable or vulnerable citizens, such as in nursing homes or also healthcare workers. And then hospitals and health systems and medical facilities throughout the state are doing the vast majority of the testing. They are sending those samples either to their own laboratories, their own hospital laboratories for processing, or sending them to the commercial laboratories such as Quest and LabCorp. We know that there has been somewhat of a wait in terms of getting those results, but we have recent data today that's not perfect, but it is improving, and there's a shorter wait time to get those results. Finally, there continues to be the mass testing sites in Philadelphia and in Montgomery County. However, even though we have worked to expand testing throughout the state, we do not have the capacity to do population-based testing and test non-symptomatic individuals. So I know that there are concerns about people who are either asymptomatic or pre-symptomatic, meaning before they have symptoms, potentially spreading the disease, but there is not the laboratory capacity really anywhere in the United States to do that type of population mass testing of large groups of people. And so maybe sometime in the future, but not at this time.
Secretary, from Penn Live, what is the department's guidance for EMS companies concerned about their supplies of personal protection equipment or funding to stay operational during the epidemic? Do you have any guidance for maintaining ambulance staff as EMTs are diagnosed positive?
Well, so our EMTs and EMS agencies are absolutely critical during this global pandemic of COVID-19. So we'll do everything we can to help them. We will provide EMS officials with and EMS workers with personal protective equipment. In addition, we'll work to make sure that they continue to be funded. Yes, if an EMS technician is positive for COVID-19, then they will need to be isolated and will need to track their close contacts for quarantine. That can put a strain on EMS agencies, and we will work with the counties to maintain their functions and make sure that EMS capabilities are available anywhere in the state.
Secretary, from the Scranton Times, most of the cases in Northeast Pennsylvania are coming from Luzerne, Monroe, Lehigh, and Northampton counties. Any idea why? Luzerne seems particularly concerning given that it's further away from the border than the other three.
Well, we are seeing, as the governor said, community spread of Pennsylvania throughout the Commonwealth. And so it's hard to know exactly why certain areas are higher than others. Of course, the area that's been most hard hit is the southeast because of the population density. So we will work with the counties and try to